without any heading. You know, after spending decades in medicine, I've seen thousands of patients come through my office with the same complaint. Their knees hurt, their hips ache, their shoulders feel stiff when they wake up in the morning. And you know what most of them say? Dr. Fauci, I don't want to take another pill. There has to be something else. Well, I've got news for you. There absolutely is. And in the next 25 minutes, I'm going to walk you through a protocol that I've seen transform people's lives. Not in weeks, but in real, measurable ways that actually stick around. So if you're tired of joint pain limiting what you can do, stick around because we're diving deep into what actually works. Look, I want to be straight with you from the start. I'm Dr. Anthony Fauci, and I've spent my entire career looking at what the science actually says, not what supplement companies want you to believe, and not what the latest fad diet is pushing. Today, we're talking about something that affects over 50 million Americans, joint pain in seniors. And here's what I want you to know by the end of this video. You're going to understand exactly why your joints hurt, and I mean the real biological reasons. You'll learn about 5 core anti-inflammatory strategies that actually have research behind them. You'll discover which supplements are worth your money and which ones are basically expensive placebo. And you'll get a step-by-step protocol that you can start implementing today. No gimmicks, no false promises, just science. Let's start with the fundamentals. Your joint pain isn't really about your joints getting old. That's what people think, but it's not accurate. What's actually happening is inflammation. Think of inflammation like a fire in your body. When you're younger, your immune system is like a well-trained firefighter. It puts out the fire, and then it goes back to the station. But as we age, something shifts. The inflammatory response doesn't turn off as quickly. It's like the alarm keeps going off even after the fire is out. And chronic inflammation is what destroys cartilage, irritates synovial fluid, and creates that grinding, aching feeling you get when you move. Now here's the critical part, and I want you to really understand this because it changes everything. Most joint pain in seniors isn't caused by structural damage alone. It's caused by the inflammatory environment around that joint, which means we can actually do something about it. We're not just managing symptoms here. We're addressing the root cause. Let me explain what's happening at the cellular level. Your body produces something called cytokines. These are chemical messengers that tell your immune system whether to fight or rest. In a young, healthy person, this system is balanced. But as we age, you get an increase in something called TNF-alpha and interleukin-6. These are pro-inflammatory cytokines. It's like your immune system's alarm system gets stuck on high alert. And once that alarm is constantly ringing, it damages the tissue around your joints. Now, here's where most doctors get it wrong. They treat the pain with non-steroidal anti-inflammatory drugs. NSAIDs work, yes, but they come with real risks: gastrointestinal bleeding, kidney problems, cardiovascular issues if you take them long-term. What we want to do instead is address the underlying alarm system. We want to turn down the volume on that chronic inflammation at the source, and that's exactly what this protocol does. Here's something that surprised a lot of my patients. Your gut health is directly connected to your joint inflammation. This isn't some wellness trend. This is published science. Your gut microbiome produces metabolites that regulate your immune system. When you have dysbiosis, that's an imbalance in your gut bacteria, you get increased intestinal permeability. Some people call it leaky gut. Now, leaky gut allows bacterial lipopolysaccharides to cross into your bloodstream. These trigger your immune system to activate, which creates systemic inflammation. And where does that inflammation settle? Often in your joints. So before we even talk about specific supplements or dietary changes, you need to understand that fixing your gut is foundational. It's like trying to build a house on a cracked foundation. You can decorate it all you want, but it's still going to have problems. The first pillar of this protocol is actually gut health, and that's where we need to start. Let me be clear about something. The Mediterranean diet isn't just a buzzword. Multiple large-scale studies, including the PREDIMED trial, have shown that this diet specifically reduces inflammatory markers in the blood. Now, I'm not saying you need to move to Greece and eat olives for every meal. What I'm saying is that the principles work. You want to focus on omega-3 rich foods. That means fatty fish like salmon, mackerel, and sardines at least 3 times a week. You want plenty of colorful vegetables. The anthocyanins and polyphenols in vegetables like blueberries, spinach, and kale are natural anti-inflammatories. You want extra virgin olive oil. The compound oleocanthal in olive oil actually works similarly to ibuprofen, but without the side effects. And here's the critical part. You want to eliminate or significantly reduce foods that promote inflammation. That means refined carbohydrates, processed foods, and excessive seed oils. Now, I know that sounds restrictive, but the patients who actually do this see measurable improvements in joint pain within 3 to 4 weeks. The swelling goes down, the stiffness in the morning decreases, and they get their mobility back. I want to talk specifically about omega-3 fatty acids because the research here is really compelling. Multiple randomized controlled trials have shown that omega-3 supplementation reduces joint pain and swelling in people with arthritis. The mechanism is straightforward. Omega-3s are converted into compounds called resolvins and lipoxins. These are natural resolution signals in your body. They're like telling your immune system to stand down. They stop the inflammatory cascade. Now, if you're getting fatty fish 3 times a week, you're probably getting enough from diet. But if you're not, a fish oil supplement with at least 2 grams of combined EPA and DHA is worthwhile. The studies that show benefit typically use this dose. And here's something important. Quality matters. You want a supplement that's been third-party tested for heavy metals and oxidation, because oxidized fish oil actually increases inflammation rather than decreasing it. So don't just grab the cheapest bottle at the pharmacy. That's actually counterproductive. Now let's talk about curcumin, which is the active compound in turmeric. And I'm going to be honest with you because this is where a lot of misinformation exists. Plain turmeric powder, the stuff you put in your food, has very poor bioavailability. You'd need to eat an enormous amount to get therapeutic benefit. But when curcumin is extracted and combined with piperine from black pepper, or when it's formulated with phospholipids, the absorption dramatically increases. The research is solid. Curcumin reduces TNF-alpha, interleukin-6, and other inflammatory markers. Multiple studies have shown it's as effective as some NSAIDs for reducing joint pain and swelling, but without the gastrointestinal side effects. Here's what I recommend. Look for a curcumin supplement that specifically states enhanced bioavailability. Something like Mariva or BCM95 are well-researched forms. A dose of 500 to 1,000 milligrams per day split into 2 doses is what the studies typically use. And you need to be patient. Curcumin takes about 2 to 3 weeks to build up in your system and show effects. But once it does, the results are consistent and sustained. Let me introduce you to something that doesn't get nearly enough attention: Boswellia serrata, also known as frankincense. In Ayurvedic medicine, this has been used for thousands of years. But here's the exciting part. Modern science has validated it. Boswellia contains boswellic acids that inhibit the 5-lipoxygenase enzyme. That enzyme is critical in the inflammatory pathway. By blocking it, you reduce the production of pro-inflammatory molecules. The clinical trials are impressive. In one study, published in a peer-reviewed journal, patients with knee osteoarthritis who took Boswellia extract showed significant improvements in pain and function compared to placebo. And get this, there were minimal side effects. A typical dose is 300 to 500 milligrams of a standardized extract 3 times daily. Now, Boswellia works synergistically with curcumin. That means they work better together than they do individually. So I typically recommend combining them as part of this protocol. This is where I need to give you the real talk. Glucosamine and chondroitin are everywhere. They're heavily marketed, and I'll be honest with you, the evidence is mixed. Some older studies showed benefit, but more recent and more rigorous meta-analyses suggest that the effect is modest at best, and possibly just placebo. The reason is bioavailability. When you swallow glucosamine, your digestive system breaks it down. It doesn't necessarily get to your joint cartilage in a form that your body can use. Now, if you're already taking it and you feel like it's helping, there's no harm in continuing. Placebo effect is real, and if it's working for you, that matters. But I'm not going to recommend it as a primary intervention in this protocol. Instead, I'm going to recommend something that actually has better evidence behind it. That something is ginger, specifically standardized ginger extract. Ginger contains compounds called gingerols and shogalls. These work through multiple anti-inflammatory pathways. They inhibit NF-kappa B, which is a master switch for inflammation. They also have COX-2 inhibiting properties, which is the same mechanism that NSAIDs use, but ginger comes with far fewer side effects. The clinical evidence is solid. Multiple studies have shown that ginger extract reduces joint pain and swelling in osteoarthritis, sometimes as effectively as ibuprofen. And here's the bonus. Ginger also helps with nausea, supports digestion, and has cardiovascular benefits. A dose of 1,000 to 2,000 milligrams of dried ginger extract per day is typical in the studies. Fresh ginger is great in your diet, but you won't get therapeutic doses just from cooking, so a supplement makes sense for joint pain management. Now, let me talk about something that connects all these supplements together, and that's your micronutrient status. Vitamin D deficiency is epidemic in seniors, especially in northern climates, and especially if you're not getting enough sun exposure. Vitamin D is absolutely critical for immune regulation. Studies show that people with low vitamin D levels have higher inflammatory markers and worse joint pain. I recommend getting your vitamin D level tested. You want to be somewhere between 40 and 60 nanograms per milliliter. If you're below that, supplementing with 2,000 to 4,000 IU of vitamin D3 daily is important. Similarly, magnesium is critical for hundreds of enzymatic processes, including inflammation regulation. Many seniors are magnesium deficient. A dose of 300 to 400 milligrams in the evening is beneficial for both inflammation and sleep quality, which, by the way, is critical for healing. Let me pause here because I want to reset your expectations. This protocol is not a magic bullet. If you're looking for something that you take once and your joint pain disappears, that's not realistic, and anyone promising that is selling you snake oil. What this protocol does is address the fundamental inflammatory processes that drive joint pain. It takes time. Most of my patients see meaningful improvements over 4 to 8 weeks. But here's what's remarkable. Once you're 2 or 3 months in, the changes stick around. You're not in a constant fight. You're not taking medications with serious side effects. You're actually addressing what's causing the problem. And that's the difference between managing disease and actually resolving it. Now I want to talk about the movement piece, because inflammation and immobility create a vicious cycle. When your joints hurt, you move less. When you move less, your joints stiffen up and inflammation actually gets worse. It's counterintuitive, but gentle movement is one of your most powerful anti-inflammatory tools. I'm not talking about running marathons or hitting the gym hard. I'm talking about consistent, gentle movement. Walking 20 to 30 minutes most days of the week is phenomenal. Swimming or water aerobics is even better because water supports your joints while you move. Tai Chi has incredible research behind it for both joint pain and balance. Yoga, specifically gentle or restorative yoga, improves mobility without overloading joints. The key is consistency. 15 minutes of daily movement beats one intense session followed by a week off. Your joints and your immune system respond to consistent stimulus, so this needs to be part of your daily routine. Here's something that most people completely overlook, and it's critical: sleep quality. When you're not sleeping well, your body ramps up inflammation. This is established science. During deep sleep, your body produces anti-inflammatory compounds. If you're not getting deep sleep, you're literally working against your anti-inflammatory protocol. So how do you improve sleep? First, your bedroom needs to be dark, cool, and quiet. Your sleep environment matters more than people realize. Second, get sunlight exposure early in the day. This sets your circadian rhythm and helps you sleep deeper at night. Third, avoid screens at least an hour before bed because blue light suppresses melatonin. Fourth, I mentioned magnesium in the supplement section, but taking it at night specifically supports sleep. And fifth, consistent sleep schedule is crucial. Your body thrives on rhythm. Let me give you the stress piece, because stress is a massive driver of inflammation that people underestimate. When you're chronically stressed, your body produces cortisol and other stress hormones. These actually amplify inflammation. So managing stress isn't just about feeling better mentally, though that matters too. It's actually a physiological anti-inflammatory intervention. What works? Meditation, even just 10 minutes a day, has been shown to reduce inflammatory markers. Breathing exercises activate your parasympathetic nervous system, which is your body's anti-inflammatory system. Social connection is powerful. Isolation increases inflammation. Being in nature reduces stress and inflammation. Hobbies that you enjoy are medicine. So this isn't fluff. This is actual biology. You need to build stress management into your protocol the same way you're taking supplements. Let me synthesize everything we've talked about into a practical, implementable protocol. Week 1. You're going to start with the dietary changes. Mediterranean diet principles, focusing on omega-3 rich foods, colorful vegetables, and eliminating processed foods. You're going to begin a gentle daily movement practice, let's say 20 to 30 minutes of walking. You're going to prioritize sleep quality with the environmental and timing strategies I mentioned. and you're going to start a basic supplement regimen with vitamin D, magnesium, and omega-3s if you're not getting them from food. Don't add everything at once. Your body needs time to adapt. By week 3 or 4, when you're stable on those foundational interventions, you can add curcumin and boswellia. Give that another 2 weeks. Then, if you want to add ginger extract, you can do that. This staggered approach lets you know what's actually working for you, rather than starting everything simultaneously and not knowing which intervention is making the difference. Now, I also want to tell you about something called low-level laser therapy, or photobiomodulation. There's emerging research showing that specific wavelengths of light can reduce inflammation in joints. It's not mainstream yet, but if you have access to a physical therapy clinic that offers this, it's worth exploring. Similarly, some of my patients have had success with acupuncture. The mechanism isn't fully understood, but the research shows real benefits for osteoarthritis pain. These aren't replacements for the other interventions we've discussed, but they can be valuable additions if you're interested. Here's what I want to be clear about before we wrap up. If you have severe joint pain, if you're having trouble with mobility, or if you're on medications for this, you need to work with your doctor. Don't stop your medication suddenly. Don't think supplements are going to replace necessary medical care. What this protocol does is enhance your results. It gives your body the tools to reduce inflammation naturally. It works with your body's own healing mechanisms. And when you combine this with appropriate medical care, that's when you get the best outcomes. The patients who see the most dramatic improvements are the ones who implement multiple aspects of this protocol simultaneously. It's not just the supplements, it's not just the diet, it's not just the movement, it's the combination. It's the synergy between better nutrition, strategic supplementation, consistent gentle movement, quality sleep, and stress management. That's what actually transforms lives. And that's what I've seen over and over again across decades of practice. So here's what I want you to do. If you found this valuable, if you're ready to take control of your joint pain and actually address what's causing it, hit that subscribe button right now. I put out videos every week diving deep into health topics with the same level of scientific rigor and honesty that I've used throughout my career. You're going to learn things that mainstream medicine often glosses over. You're going to get protocols that actually work, and you're going to be empowered to take your health into your own hands, which is honestly the most powerful thing you can do. Subscribe now and join thousands of people who are taking their health seriously and seeing real results. Thank you for watching, and I'll see you in the next video.